This waxy plaque is working overtime to build up on the inner surface of arteries and veins. Soon this will extend to arteries that supply blood to the heart. It's time to control the culprit, the high cholesterol in your blood, before it's too late. It's now time to take a relook at your lifestyle. Cholesterol is a fat-like substance circulating in your blood. While the bulk of it is actually made in your own body, specifically in the liver, some of the fat comes from your food. Cholesterol is a component of cell membranes and is found in all body tissues. It is then converted into various hormones. That is why, in reasonable amounts, cholesterol is actually critical to good health. But in the kind of lifestyle that we lead today, we often overshoot the normal levels, leading to heart disease. Let us take a look at what your cholesterol report means. Cholesterol measurement consists of measuring the levels of LDL cholesterol, HDL cholesterol, and total cholesterol and triglycerides. Low-density lipoprotein cholesterol, or LDL, is bad cholesterol. It can clog your arteries, increasing the risk of heart attack and stroke. High-density lipoprotein cholesterol, or HDL, is good cholesterol. HDL attaches to bad cholesterol and helps filter it out of the body. Total cholesterol is a sum of all types of cholesterol in your blood. It's less significant than HDL and LDL levels. Triglycerides are another type of fat floating in your blood. Having a high level of triglycerides increases your risk of cardiovascular problems. Increased level of triglycerides, or hypertriglyceridemia, is an independent risk factor for heart disease. If you suffer from abnormal levels of fat in your body, knowing the reason can help you to work towards controlling it. Let us see what are the normal levels recommended by the National Cholesterol Education Program Adult Treatment Panel 3. The ideal HDL level for males should be 40 mg per dl, whereas that for females should be 50 mg per dl. The normal LDL level should be less than 100 mg per dl. For triglycerides, it should be less than 150 mg per dl. And finally, the total cholesterol level should be less than 200 mg per dl. Now let's understand the causes of high cholesterol. Eating too much saturated fat can cause high cholesterol. Being overweight may increase triglycerides and decrease HDL. And lack of physical activity may increase LDL and decrease HDL. Age and gender also play a role. After you reach age 20, your cholesterol levels naturally begin to rise. In women, cholesterol levels stay fairly low until menopause, after which they rise to about the same level as in men. Having certain diseases such as diabetes or hypothyroidism, family history, and cigarette smoking can predispose you to high cholesterol. Lowering your high blood cholesterol level is the obvious way to lower your risk of heart disease. This will slow fatty buildup in the walls of the arteries and reduce your risk of a heart attack. Triglycerides the natural byproducts of the body's daily functioning are much more responsive than cholesterol to lifestyle changes such as exercising and eating a low-fat diet. Triglycerides are also lowered automatically when you lower your cholesterol. Unfortunately, as people get older and heavier, triglycerides along with cholesterol levels tend to rise. And while high cholesterol is often a consequence of aging, young people can have it too. Fortunately, you can do something about it. The best way towards a healthy heart is to maintain a healthy cholesterol level. Modify your risk factors to lower cholesterol and prevent the development of coronary artery disease. In short, ways to lower your cholesterol are eating a healthy diet, exercising, losing weight, taking medicine in some cases. Many need a combination of approaches. Eat no more than 300 milligrams of cholesterol a day. Limit your total fat intake to less than 30% of calories, with less than 10% coming from saturated fats. You can accomplish this by choosing more fruits, vegetables, and whole grains instead of fatty meats and bakery goods. Eating fish, poultry without skin, and lean meats instead of fatty ones. Consuming low-fat or skim milk dairy products instead of whole milk dairy products. Diet tends to help people lower triglycerides and raise good HDL cholesterol, but it's less likely to have a big impact on bad LDL cholesterol. Losing weight can lower your bad LDL cholesterol and triglycerides. It can also raise your good HDL cholesterol. So what happens if diet, exercise, and weight loss aren't enough to bring your cholesterol under control? Your doctor might recommend medicine. Medicine may also be a first choice for people who have other risk factors. Since high cholesterol comes without any symptoms, if you unknowingly have high cholesterol and other disease risk factors, there can be serious health complications. High cholesterol can lead to heart disease, stroke, diabetes, and other health problems. Here's why it's important that you lower your cholesterol. High cholesterol levels are one of the most important modifiable factors for coronary artery disease. Coronary heart disease can be deadly because if the heart cannot get nutrients from the blood as a result of a block, it is not able to adequately pump blood to the rest of the body. Cholesterol, if untreated, may lead to complications of atherosclerosis, coronary artery disease, and heart attack.
The human body is made up of different types of tissues, like the tissues of bone, muscle, nerve, skin, and gut. The tissues require oxygen and nutrients to carry out their function and to grow. This is supplied by the blood vessels, which form a network throughout the body tissues. The force for the blood flow in this network is provided by the heart, which acts as a pump. Vessels which carry the blood from the heart to the different parts of the body are called arteries. Their counterparts are the veins which carry the blood back to the heart. The heart itself depends for its blood supply on the coronary arteries, which are branches given out by the main artery called the aorta. Arteries carry blood that is enriched with oxygen and nutrients to the body tissues, including the vital organs such as the brain, heart, liver, and kidneys. Arteries also transport blood to other parts such as the muscles, bones, nerves, and skin. Healthy arteries can deliver an ample supply of blood to the organs and tissues. However, if the supply of blood to any part of the body is reduced due to blockage of the blood vessels, then that part is not able to function efficiently, causing disease. Atherosclerosis is a condition in which fatty material is deposited along the walls of arteries. This fatty material thickens, hardens, and tends to block the arteries. This leads to a reduction in blood supply to the tissues which the artery supplies. More than half the number of human deaths are caused by atherosclerosis. Atherosclerosis is a slow, complex disease which starts in childhood, beginning with damage to the innermost layer of the artery. This layer is called the endothelium. The damage to the arterial wall may be because of elevated levels of cholesterol and triglyceride, high blood pressure, tobacco smoke, and diabetes. Because of the damage to the endothelium, fats, cholesterol, platelets, cellular waste products, calcium, and other substances are deposited in the artery wall. This thickens the endothelium. The artery's diameter shrinks and blood flow decreases, reducing the oxygen supply. Although any artery may be affected, the major targets are the aorta, coronary, and cerebral arteries. Atherosclerosis of the coronary arteries in the heart leads to ischemic heart disease characterized by chest pain on exertion. Atherosclerosis of the aorta causes poor blood supply to the intestine and limbs. Poor circulation to the legs can lead to pain while walking or exercising, deficient wound healing, and leg ulcers. If the atherosclerosis is severe, it may cause aortic aneurysms or abnormal dilations, which may sometimes rupture to produce massive internal bleeding. However, this condition is most severe when the plaque thickens and hardens. This may lead to the plaque to rupture and blood clots to form at the site. The blood clots may break off and travel to another part of the body where they may lodge in a small vessel and suddenly block it. If it blocks a blood vessel that feeds the heart, it causes a heart attack. In the brain, this causes a stroke. And if this occurs in the arms or legs, it can lead to gangrene. When diagnosed early, atherosclerosis can be controlled by changing the lifestyle to eliminate the risk factors. This is supplemented by medicine to control the risk factors. The risk factors are history of raised cholesterol levels and heart disease in the family, smoking, hypertension, and diabetes. The presence of any of these risk factors increases one's chances of suffering from atherosclerosis. It is important to remember that the effect of the risk factors is multiplicative rather than additive. This means that people with a combination of the risk factors are at a very high risk. One can prevent atherosclerosis by evading the risk factors. It is possible to steer clear of increased blood cholesterol levels and diabetes by taking a balanced diet. Hypertension can be controlled too by managing stress and with medication if necessary. And smoking can be completely avoided. As atherosclerosis makes the coronary artery narrower, the blood flow in it slows, and this deprives the heart of oxygen. This oxygen deprivation is called ischemia, which gives this condition the name ischemic heart disease. One feels the ischemic pain especially on increasing activity, as the narrowed coronary artery cannot provide the additional oxygen required by the heart. On resting, the body's demand for oxygen decreases and the ischemic pain is relieved. If the coronary artery becomes blocked by a blood clot, the blood supply to the heart suddenly stops, causing a heart attack. There is a feeling of intense pain felt as a crushing weight against the chest and is accompanied by profuse sweating. The pain may radiate to the left shoulder and arm, the neck or jaw, and even to the right arm. The arm may feel numb. However, it should be noted that the degree of pain and symptoms before a heart attack vary among people. Some may feel severe pain, others might feel only a tingling sensation. Some people may only have a sense of fullness, squeezing, or pressure in the chest. A feeling of nausea, vomiting, indigestion, or heartburn is common. On experiencing the symptoms of heart attack, it is paramount to seek emergency medical help immediately. Anatomy of coronary arteries. The heart pumps blood for itself through the coronary arteries. These are branches given out by the main artery, the aorta. They spread out over the surface of the heart, giving it a direct supply of oxygen-rich blood. The right coronary artery supplies the right and bottom surfaces of the heart. The left coronary artery supplies the left side and front surface, the larger portion of the heart. The human body is made up of different types of tissues, like the tissues of bone, muscle, nerve, skin, and gut. The tissues require oxygen and nutrients to carry out their function and to grow. This is supplied by the blood vessels, which form a network throughout the body tissues. The force for the blood flow in this network is provided by the heart, which acts as a pump. The heart pumps blood for itself through the coronary arteries. These are branches given out by the main artery called the aorta. When one is resting, the heart beats at a slow rate. On increasing activity, the body's demand for oxygen increases and the heart has to beat at a faster rate to provide more oxygenated blood to the body. As the heart works harder, it requires more oxygen. In a healthy heart, the coronary arteries are wide enough to allow more blood flow to the heart, providing the additional oxygen. As the heart's demand for oxygen is met, one feels comfortable. The arteries in the body can be affected by a disease called atherosclerosis, in which fatty material is deposited along the walls of the arteries. This fatty material thickens, hardens, and tends to block the arteries, causing a reduction in blood supply to the tissue which the artery supplies. Atherosclerosis of the coronary arteries supplying the heart leads to ischemic heart disease characterized by chest pain on exertion. Atherosclerosis is a slow, complex disease which starts in childhood, beginning with damage to the innermost layer of the artery. This layer is called the endothelium. The damage to the arterial wall may be because of elevated levels of cholesterol and triglyceride, high blood pressure, tobacco smoke, and diabetes. Because of the damage to the endothelium, fats, cholesterol, platelets, cellular waste products, calcium, and other substances are deposited in the artery wall. This thickens the endothelium. The artery's diameter shrinks and blood flow decreases, reducing the oxygen supply. Although any artery may be affected, the major targets are the aorta, coronary, and cerebral arteries. Atherosclerosis of the coronary arteries in the heart leads to ischemic heart disease characterized by chest pain on exertion. However, this condition is most severe when the plaque thickens and hardens. This may lead to the plaque to rupture and blood clots to form at the site. The blood clots may break off and travel to another part of the body where they may lodge in a small vessel and suddenly block it. If it blocks a blood vessel that feeds the heart, it causes a heart attack. If the ischemic heart disease is severe, surgery like angioplasty or bypass surgery may be necessary to restore the normal blood supply. Angioplasty includes dilating the blocked blood vessel using a tiny balloon inside the affected artery. In bypass surgery, the blocked section of the coronary artery is bypassed by using a blood vessel from the leg or attaching another artery from the chest beyond the affected site. Very severe disease can only be cured by heart transplantation. When diagnosed early, ischemic heart disease can be controlled by changing the lifestyle to eliminate the risk factors. This is supplemented by medicine to control the risk factors. The risk factors are history of raised cholesterol levels and heart disease in the family, smoking, hypertension, and diabetes. The presence of any of these risk factors increases one's chances of suffering from ischemic heart disease. It is important to remember that the effect of the risk factors is multiplicative rather than additive. This means that people with a combination of the risk factors are at a very high risk. One can prevent ischemic heart disease by evading the risk factors. It is possible to steer clear of increased blood cholesterol levels and diabetes by taking a balanced diet. Hypertension can be controlled too by managing stress and with medication if necessary. And smoking can be completely avoided.
Our heart tirelessly works for us throughout our lifetime. always at our service. It is a continuously working pump which generates pressure to push and distribute blood to all the tissues of the body through blood vessels. It receives deoxygenated blood for purification from the veins and pumps out oxygenated blood for tissue metabolism through the arteries. Thus, both arteries and veins play an important role in the flow of blood. The pumping action of the heart creates a definite pressure on the cardiac muscles forming the heart wall, which causes the blood to flow through the arteries. This is called as blood pressure, popularly known as BP. Cardiac muscles forming the heart wall contract to push out the blood from its chamber to a great artery called aorta, while cardiac muscles relax to receive the blood from great veins called inferior and superior vena cava. This contraction and relaxation of heart chambers respectively gives rise to systolic and diastolic pressure within the wall. Systolic pressure indicates the pressure that the heart generates to pump blood to the rest of the body, whereas diastolic pressure refers to the pressure in the blood vessels between heartbeats. Blood pressure is expressed in two separate figures. The first indicates systolic pressure and the second diastolic. It is known that systolic pressure increases as we grow old, while diastolic pressure begins to decline after 60 years. However, the force with which the heart pumps increases when there is an increased demand of blood supply to various tissues, like in the case of exercise, or when normal blood flow has to occur through narrowed vessels, as in the case of atherosclerosis. This gives rise to increased blood pressure or hypertension. Hyper means excess or over the normal limits. Hypertension can be temporary, only to meet a required demand, as in the case of exercise. It is a sign that the heart and arteries have to overwork. Significantly, it is persistent hypertension that leads to various health problems. Hypertension is one of the leading killer diseases in the world today. Hey, there is no reason to get alarmed. Much depends on us and on our positive initiatives. Our present discussion is about hypertension, its causes, signs, symptoms, complications and modes of management. First things first, let us know the criteria to term our blood pressure as hypertension. For an individual, systolic blood pressure measuring 140 millimeters of mercury or greater and diastolic blood pressure measuring 90 millimeters of mercury or greater can be referred to as hypertension. Higher level than this is alarming and should be paid immediate attention. Ignoring it increases the risk of various health complications. Blood pressure is measured with sphygmomanometer. Pressure cuff is applied to the arm, and the cuff pressure just above where the arterial pulsation at wrist disappears is slowly increased. This marks the time when artery is made to collapse temporarily by manual pressure. Then pressure is slowly released to listen to the typical sound produced with the help of a stethoscope. Appearance and disappearance of this sound helps to assess systolic and diastolic pressure. So we come to the next question. When and how do we test ourselves? Ideally, blood pressure readings should be taken at rest without having any stimulant like coffee or tea or smoking. A minimum of 2 readings should be recorded and averaged at 2 different occasions. If these readings are above specified value, then it is indicative of hypertension. You can be self-reliant and learn to take these readings at home, so that occasions of sudden increase in blood pressure can be timely recognized and immediate remedial actions taken. Many a times, hypertension is latent. You may not have any symptoms and it may go unnoticed for years. But watch out! Symptoms such as headaches, dizziness, fatigue, and ringing in the ears may be due to hypertension. Clinical examination of eyes, heart, and nervous system prove helpful to ascertain the involvement and evaluate the severity of organ damage caused in long-standing or malignant hypertension. Blood tests are conducted to check kidney and thyroid functioning. And an electrocardiogram or ECG reveals thickening of the heart muscles and irregular heart rhythms. Secondary hypertension needs identification of a treatable cause. Based on cause and characteristics, hypertension is classified into various categories. Most common and idiopathic essential hypertension which is not preceded or occasioned by any other disease. Isolated systolic hypertension, especially in the elderly. Treatable secondary hypertension in young patients. Symptomatic and fluctuating labile hypertension, or in other words, unstable hypertension. Life-threatening malignant or harmful hypertension which is marked by an unusually sudden rise in blood pressure to attain dangerous levels. Such a case indicates medical emergency and needs hospitalization. In 6 to 8% cases, hypertension occurs during pregnancy. It manifests as chronic, preeclampsia or gestational hypertension, which develops slowly. Obesity, diabetes, smoking, stress and alcoholism are known to increase the risks of hypertension and the subsequent complications. Undiagnosed or incompletely treated hypertension can cause damage to many organs, including the blood vessels, brain, eyes, heart, and kidneys. This may give rise to the risk of having a heart attack, stroke, kidney failure, and blindness. Just go through the above factors again. Don't you agree that this life-threatening ailment is self-invited, self-afflicted? So, be vigilant, make positive changes. These facts are alarming, aren't they? Fortunately, there are simple preventive measures. Invest just 10 minutes in regular aerobic exercise. Is that asking for more? Limit your salt intake. It makes your food tasty, but not your life. Eat a diet rich in fruits and vegetables and low in saturated fats. Avoid smoking and alcohol. Maintain a desirable body weight. Learn to manage stress. Use stress-relieving techniques such as yoga, meditation. Regular checkup and monitoring of blood pressure with lifestyle modification would certainly help to prevent complications. It will also enhance the quality of your life.
Like any other living tissue, heart muscles need blood and oxygen supply for their normal functioning. The blood vessels that supply blood and oxygen to the heart muscles are known as coronary arteries. Cholesterol deposition on the wall of this artery is called plaque. Formation of plaque in the blood vessels causes narrowing of the blood vessels. This can affect one or more arteries. When the arteries get narrowed, they are not able to supply adequate amount of blood and oxygen to the pumping heart. This lack of oxygen in the heart muscle causes chest pain or angina. When arteries are narrowed in excess, or when a blood clot forms on the plaque, the artery may become completely blocked, causing death of a part of the heart's muscles. This is known as a heart attack. An angiography is a reliable procedure to detect the narrowing of blood vessels. It is an X-ray visualization of the heart's blood vessels. During an angiography, a flexible tube called a catheter is inserted through the blood vessel of the thigh or the arm towards the blocked segment of the heart artery. A dye is injected through the catheter so that X-ray images of the heart's blood vessels can be obtained. If the angiography does not show a blockage, the patient is allowed to go home after the test is complete. However, if the angiography shows blockage, the doctor may perform a coronary angioplasty after visualizing the details of the block. A stent is a tiny, slender, expandable metal tube that fits inside a blood vessel once the blood vessel has been widened. To insert a stent, the doctor removes the angioplasty balloon catheter and inserts a new catheter on which a closed stent surrounds a deflated balloon. The stent-carrying catheter is advanced through the artery to the site of the blockage. The balloon is inflated, causing the stent to expand and fit on the inside of the artery. The balloon is then deflated and the catheter withdrawn, leaving the stent in place. The stent is left in the blood vessel permanently to keep it from closing up again. Follow the instructions regarding the intake of medications as directed by your doctor. In preparation for the coronary angioplasty, your doctor may stop or adjust the doses of the regular medications several days prior to or on the day of the procedure. Be sure to tell your doctor if you have had any allergic reaction to any substance or drug or have any history of bleeding problems. Pre-procedure tests like chest X-ray, ECG, blood examination are scheduled before the procedure. You will be asked to sign several consent forms stating that you understand the procedure and are ready to comply with the medical team for the same. The patient is relaxed with a mild sedative before the procedure. The area from where the procedure will be started, usually the thigh or the arm, is shaved to remove hair and prevent infection. The area is cleaned with a special antibacterial agent and covered with sterile drapes to prevent infection. A numbing medication, local anesthetic, is injected into the skin over the blood vessel of the thigh or the arm. This may feel like a mild sting, which lasts only a few seconds and will keep the area pain-free. The blood vessel is punctured with a needle and a thin guide wire is inserted into the artery and advanced towards the blocked segment of the coronary artery. Then, a long, thin plastic tube called a catheter is passed over the guide wire towards the blocked segment of the coronary artery. A deflated balloon is placed at the tip of the catheter. After the tip of the catheter reaches the blocked segment of the heart artery, the balloon is inflated. With the inflation of the balloon, the plaque is flattened and the blood vessel is opened up. The balloon is then deflated and removed. When the catheter is removed after the procedure, pressure is applied at the site of the catheter insertion to ensure there is no bleeding. After the angioplasty, there is a risk that an artery will become blocked or narrow again at the same site. In order to keep the blood vessels open, doctors use a device called a stent. Coronary angioplasty is a medical procedure which opens up blocked blood vessels, thereby restoring blood flow to the heart's muscles. Coronary angioplasty may be needed to reduce chest pain caused by reduced blood flow to the heart's muscles, minimize damage to heart muscle from a heart attack. This procedure is sometimes done as an emergency procedure after an angina or heart attack.